We were part of a 60-man team that was deployed to the Geshkio Field Hospital. We were set up in the middle of one of the poorest neighborhoods in the middle of Port-au-Prince, and so everything was fairly primitive. We were working out of tents. There was no air conditioning. There was no kind of all those environmental control things. So our temperatures were getting up into the upper 90s most days. Most of the good sound buildings that you might have wanted to set up an emergency hospital in had been significantly damaged by the earthquake, and we didn't feel like it was safe to try and use any of the buildings. So we were in tents. We had an operating room with full general anesthesia equipment, one operating room. We had a tent that was set up as our intensive care unit with capable of treating 4 patients at any given time. Then numerous other treatment tents where we could do post-operative care or even minor surgical procedures under local anesthetic. So I primarily worked in our post-operative wound management area, where I was taking care of the injuries that were now many weeks old, and they needed further skin cleaned up, further infection worked with. Frequently there would be an amputation that had been performed that needed to be revised or changed so that it would heal better. A lot of the broken bones required remanipulation or lining them back up in a better fashion. There were 2 phenomenal emotions or feelings that I came back after there and after visiting that country. One, the poverty is just horrendous. The number of people that have virtually nothing even before the earthquake, and now after the earthquake have nothing. So all of our hearts just went out to the conditions those people were having to try and just survive from day to day. But then the contrast to that was the resiliency of the people. The smiles. These were folks that had phenomenally positive attitudes. They were a delightful group of people to work with. I felt like I got a lot out of having the privilege and the honor of working with the Haitian people. You get this little bit of a feeling of, are we actually accomplishing anything? You look around and there's hundreds of thousands to millions of people that are living in this horrible poverty, and you wonder if you're making a change or if you're really helping. But when you boil it down to the individual patient, and that's the one thing we kept telling each other when we were down there, we're not treating Haiti, we're just treating one patient at a time. And when you look at what our organization did, when you look at all of the other organizations that were down there, yeah, I think people from around the world, and particularly from the United States, can be pretty proud of what our combined response was to a really big catastrophe.